What I'm about to tell you is something most cardiologists would never say out loud, not because they don't know it, but because it challenges the entire system they were trained in. My name is Dr. Sonam. I've spent 22 years as a cardiac surgeon. I've operated on over 4,000 hearts. I've repaired arteries that were so damaged, so calcified, they felt like porcelain under my fingers. And every single time I close a chest after bypass surgery, I asked myself the same question. Why did it get this bad? Because in almost every case the patient had been on blood pressure medication for years. Their numbers looked fine on paper. Their doctor was satisfied. And yet, there they were on my table. Cardiovascular system crumbling from the inside. That's when I started asking harder questions. Questions about what blood pressure medication actually does, and more importantly, what it doesn't do. What I found changed the way I practice medicine. Today, I'm going to share it with you. The real reason your blood pressure is high. The reason your medication isn't protecting you the way you think it is. And the specific steps backed by cellular biology that can actually reverse the damage. Not managing it. Reverse it. Stay with me, because what you're about to learn could be the most important things you heard this year. Let's start with the model you've been given. Your doctor told you that high blood pressure is a fluid problem. Too much volume in the vessels, like overfilling a garden hoses. So they give you a diuretic, water pills to drain some of that fluid. Or they give you a pills that relaxes the vessel walls so the hose expands and pressure drops. Numbers go down. Doctor is happy. You feel fine. Problem solved. Except it is not solved, because that model, the garden hose model of hypertension, is dangerously incomplete. It's been taught in medical schools since the 1970s, and it ignores the most critical part of the equation. Your arteries are not garden hoses. They are living, breathing, dynamic structures. They expand and contract. With every heartbeat, they produce chemicals that regulate blood flow, prevent clotting, and protect themselves from damage. When they are healthy, when your blood pressure is naturally normal, they are damaged. That's when hypertension develops. And here's the problem. Every blood pressure medication on the market, every single one, is designed to manage the pressure readings. None of them are designed to repair the arteries. So, while your numbers look controlled on medication, underneath those numbers, your arteries are continuing to deteriorate, silently, progressively, until one day, the damage becomes a stroke, a heart attack, or an emergency bypass surgery. I've seen this happen hundreds of times. A patient comes into my operating room. They've been on anti-hypertensives for decades, well controlled, low risk on paper, and yet when I open their chests and look at their coronary arteries, they're rigid, calcified, sometimes nearly impossible to suture because the wall is so stiff. Medication controlled the pressure. It did not protect the vessel. That is the lie at the center of modern hypertension treatment. And once you understand it, everything changes. So if high blood pressure isn't just a fluid problem, what is it? It's a structural problem, a cellular problem, and it has 3 root causes that your doctor almost certainly never explained. Cause 1, the Glycocalyx. Inside every artery in your body, lining the innermost wall, is a microscopic protective coating called the Glycocalyx. Think of it as Teflon, a smooth, slippery layer that lets blood flow freely and keeps your vessel protected from walls. Inflammation. When this coating is intact, your arteries are healthy, blood flows smoothly, vessels stay flexible, pressure stays normal. When this coating is destroyed, everything breaks down. And here's what destroys it: blood sugar spikes, chronic inflammation, oxidative stress. Every time your blood sugar rises above 140 after a meal, it triggers a chemical reactions that strips away with this coating. Every processed meal, every surge of inflammation, every cigarette, more coatings stripped away. Once it's gone, your vessel wall is exposed. Inflammation, molecules attach to it, plaque starts forming. The endothelium, the inner lining, stops producing nitric oxide, the gas that keeps your vessels relaxed and open. Your pressure rises, and no blood pressure. Medication repairs the glycocalyx. Not one. Cause 2. Arterial calcification. This is the one that keeps me up at night, because it's the one doctors miss most often. When your arteries are chronically inflamed, and they will be, if your glycocalyx has been damaged, calcium starts migrating out of your bloodstream and into your artery walls. Calcium belongs in your bones, not your arteries. But when the vessel wall is inflamed, the signals get confused, and calcium deposits begin forming in the smooth muscle layer of the artery. These deposits make your arteries rigid, stiff, inelastic. When I cut into a calcified artery during surgery, it does not spring back like healthy tissue. It does not flex. It crunches. Some are so calcified I can barely get a needle through the wall. That rigidity is not just a problem for blood pressure. It's a catastrophic risk factor for stroke and heart attack independent of your blood pressure numbers. Because here's what stiff arteries do to your heart. When your heart contracts and ejects blood, a healthy, flexible aorta expands to absorb that pressure waves. It acts like ASHIC absorbers. Then it recovering to maintain flow while your heart refills. A calcified aorta can't do any of that. The force of every heartbeat slams into your vessels. With no cushions, your systolic pressure spikes, the recoil fails, and your heart has to work harder with every single beat for the rest of your life. This leads to a measurement most doctors never take: pulse pressure. That's difference between your systolic and diastolic numbers. Normal is 40 to 50. Above 60 tells me your arteries are stiff, and a wide pulse pressure is a better predictor of cardiovascular events than either numbers alone. But no medication removes calcium from artery walls. There is no pill for decalcification. Cause 3. The Insulin-Kidney Lock. This is the mechanism that explains why millions of people restricting salt follow their doctor's advice religiously and their blood pressure still won't budge. Here's how it works. Your kidneys are the master regulators of blood pressure. They control blood pressure by controlling sodium. If you have too much sodium, healthy kidneys excreted it. Blood volume drops. Pressure normalizes. But insulin blocks that process. When insulin levels are chronically elevated, even when blood sugar is still technically normal, insulin signals the kidneys to hold on to sodium, to lock it in. No matter how little salt you eat, your kidneys are recycling every milligram. Blood volume stays elevated. Pressure stays high. This is why salt restriction fails for so many people. The lock isn't salted. The lock is insulin. And this is critical. You could have elevated insulin with completely normal blood sugar and A1C. Your doctor looks at your labs and says, everything's fine. But if they're not checking fasting insulin, and almost no one does, they're missing the actual driver of your hypertension. This condition is called hyperinsulinemia, and it's one of the most common, most overlooked causes of high blood pressure in existence. Now let's talk about what actually works. Step 1. Rebuilding the glycocalyx. First, stop destroying it. That means stabilizing your blood sugar, not just avoiding diabetes. Actually keeping your post-meal blood sugar below 140 at all times. For most people, that means cutting refined carbohydrates, sugar, white bread, white rice, pasta, pastries. The foods that send your blood sugar from 90 to 180 in 30 minutes are destroying your vessel lining with every meal. Seconds, give your body the raw materials to rebuild it. The Glycocalyx is made of sulfated sugar molecules, called glycosaminoglycans. The best dietary sources are sulfated polysaccharides from seaweeds, specifically fucoidan from brown seaweed. Studies show 500 to 100 mg daily helps restore glycocalyx thickness and improves endothelial function. Third, reduce oxidative stress through polyphenol-rich foods, berries, leafy greens, beets, dark chocolate, green tea. These foods contain compounds that neutralize the free radicals, stripping your glycocalyx apart. One of my patients, a 66-year-old named Gerald, had been on 2 medications for blood pressure, 9 years. His glycocalyx restoration took 3 months of these dietary changes plus Foucault Dan supplementation. His endothelial function test improved from 3% dilation to 11%. His blood pressure dropped from over 134/86 to 120/76. Within 6 months, he was off both medications. His glycocalyx had healed. His endothelium was functioning normally again. Step 2. Decalcify your arteries. Most people believe arterial calcification is permanent. They are wrong. Calcium doesn't deposit randomly lie in your arteries. It's directed there by a protein called matrix GLA protein, or MGP. When MGP is activated, it acts like a traffic cop, directing calcium to your bones where it belongs. When MGP is inactive, calcium deposits free lie in your vessel walls. MGP is activated by vitamin K2, specifically the MK7 forms. Studies using 180 to 360 micrograms daily of K2-MK7 have shown that arterial calcification can be slowed and stopped, and in some cases reversed. But K2 needs partners. Vitamin D drives calcium into bones, and magnesium nature's calcia channel blocker to prevent calcium from crystallizing in the vessel wall in the first place. Most people are magnesium deficient, and the form matters. Magnesium oxide, the cheapest form, is barely absorbed. Use magnesium glycinate or rionate at 400 to 600 milligrams daily. I had a 71-year-old patient, Beverly. CT scan on 4 blood pressure medications showed severe aortic calcification. After 12 months on K2, D3 and magnesium glycinate, her calcification score had decreased by 14%. Blood pressure dropped enough to come off to medications. The arteries were literally healing. Step 3. Restore nitric oxide. Nitric oxide is the gas yours endothelium produces to keep vessels relaxed and open. When your glycocalyx is damaged, nitric oxide production drops. Your vessels constrict. Pressure rises. The most effective way to restore it outside of diet is isometric exercise. Specifically, isometric hand grip training. Squeeze a gripped device at 30% of your maximum for 2 minutes. Rest 1 minute. Repeat 4 times. Do this for days a week. Multiple studies have shown this protocol lowers systolic blood pressure by 10 to 15 points. After 8 weeks, as effective as medication. The mechanism is she are stressed. The burst of blood flow after each squeeze creates friction along the vessel walls. That friction activates the enzyme that produces nitric oxide. Over time, your baseline nitric oxide production increases. Vessels stay more relaxed even at rest. And here's one more tool that costs nothing. Nasal breathing. Your nasal passages produce nitric oxide. When you breathe through your nose, that nitric oxide enters your lungs and your bloodstream. Studies show nasal breathing raises blood nitric oxide levels dramatically compared to mouth breathing. Tape your mouth shut at night if needed. The improvement in vascular tone can be significant. Step 4. Reset insulin and unlock your kidneys. The effective way to lower chronic insulin levels is time-restricted eating. Compressing your meals into an 8-hour window, say noon to 8 p.m., and fasting the remaining 16 hours. During the fast, insulin drops to its lowest levels. Your kidneys come out of retention mode. Sodium excretion normalizes. Blood volume drops. Pressure drops. Studies show 16/8 time-restricted eating lowers systolic blood pressure by 10 to 12 points within 8 weeks without changing what you eat. Just when you eat combined. This with resistance training 2 to 3 times per week. Lifting weights increases insulin receptor density in muscle cells. Your cells become more sensitive to insulin. Your pancreas produces less. Fasting insulin drops 20 up to 30% within 12 weeks in most people. Add apple cider vinegar 1 tablespoon before meals to blunt insulin spikes, and add a spoon of cinnamon daily to improve insulin receptors sensitivity. My patient Dennis 67, pre-diabetic, on 2 blood pressure medications had a fastings. Insulin of 19, normal is below 10, within 16 weeks of time-restricted eating and resistance training, his insulin dropped to 8. His blood pressure went from 144/90 to 116/74. He's been off all medication for 18 months. 4 steps. 4 mechanisms, all reversible. Glycocalyx, restoration, arterial decalcification, nitric oxide recovery, insulin normalization. This is not alternative medicine. This is cellular biology. This is what happens to your arteries at the microscopic level and what it takes to actually reverse the damage. I'm not telling you to stop your medication today. Never do that without your doctor's supervision. What I'm telling you is to start the protocols, monitor your blood pressure daily, and as your numbers improve consistently, working with your doctor to reduce medication gradually, because the medication manages pressure. This protocol fixes the pipes. You have this information now. Most people don't. Most doctors were never taught it. Use it. If this opened your eyes, do 2 things right now. Subscribe to this channel, because what I share here goes far beyond what you'll hear in any standard cardiology appointment. And hit the thumbs up so more people can find this information. And if you want the complete written protocol, exact supplement doses, meal timing schedules, exercise progressions, and how to track your vascular health at home, click the link in the description. I've put everything into a guide called the Arterial Repair Blueprints. No cost, no pitch, just the clinical information you deserve. Your arteries can heal. I've seen it happen. The only question is whether you are willing to give them the chance.